but we'll get started. So, welcome back, everybody. As we've mentioned, my name is Amber Hughes, and I'm joined today by Wendy Wood from University of Florida for our seventh session of Build Your Bones. And so this week, we kind of alluded to it last week a little bit when I was teaching with Melanie, but we will be talking more about physical activity and bone health and how that can impact your bone strength and get you another step in moving towards a healthier lifestyle. So we've kind of led up to this point throughout the 7 weeks we've been together. So excited to kind of culminate all the information that we've learned and really focus specifically on exercises and how to exercise safely to promote good bone health as we age. All right, so like I said, I'll be kicking us off this afternoon, and Wendy will be stepping in about halfway through. So just a quick reminder, we've seen this infographic quite a bit throughout our 7 weeks together. We've talked a lot about learning the facts and knowing your risk for osteoporosis, proper nutrition, and steps and goals we can take towards that to really improving and maintaining your bone health. Talked about screening and medication to determine where your bone health is currently at, and then really focusing these last couple lessons on staying strong and how we can continue to promote good bone health and continue to strengthen our bones as we age. So that's included some things such as risk management, when we look at balance and fall prevention. Last week, if you remember, your homework was to do a home hazard hunt and really take a look around your houses for any sort of fall risks, if there are loose rugs or if you have those furry speed bumps around, and really see how you can improve those fall risk items around the house. So like I said, today we'll focus more on physical activity, and that is also included with that staying strong step.
And before we go on, we have to check in with everyone to see who did their homework. So if you had took some time and the opportunity to go ahead and go throughout your house, type it in the chat. Let us know what you found.
Yeah, it'll be curious and interesting to see what people all found once they took a look around their house and their home and saw what could be, considered a fall risk, things that they maybe didn't think would be before. So put it in the chat. We love to see that interaction, that engagement throughout the presentation. So we'll give you a quick roadmap for what we'll be talking about today specifically. We're going to talk a little bit about discussing exercise strategies and how to offset age-related decline in bone density and preventing osteoporosis. Then we'll take another look at exercises for people that may already been or have been diagnosed with osteoporosis and just really differentiating the difference between the two, between those who may be looking to strengthen and maintain their bones, but then also those who may have already been diagnosed with osteoporosis. So just a quick reminder, we do have, I believe, the Q&A function. So if you do have questions as we move along today, feel free to put them in that Q&A. And we do have some wonderful chat monitors that can either answer that question or else we can address it more towards the end of class just to make sure that we get through all the information. So be sure to use that Q&A component if you have any questions. All right, so we'll talk a little bit about those risk factors for bone loss or a bone fracture. Some of these things are uncontrollable, things that we can't control really. So we're all going to be aging, can't really control whether we're male or female, or our ethnicity or family history. All of those things are good to know and could increase the risk of developing osteoporosis, certainly, but we can't control those things. So when we talk about the things that we can control, we talk about improving the calcium and vitamin D intake. We've talked about that the last few weeks, especially with our nutrition and how we can improve those intakes for those specific vitamins and minerals. But then also those lifestyle changes. And for any sort of preventable disease, we really focus on those lifestyle changes that you really do have complete control of. And some of those things that fall under that are listed below as well. Again, the choices that you make can really determine your health and can hopefully prevent the development of osteoporosis, or if you are at a higher risk, at least hold off that development of osteoporosis and allow you to remain independent and strong as you age. So I'm sure many of us on this call are already aware how great physical activity is for overall health and wellness. But when we look at individuals and people who are looking specifically for improving or building their bones, some of those benefits for exercise, we have them listed right there for you. Certainly a couple of them that we want to highlight, strengthening that connective tissue, and that can help decrease the risk of injury as we age. So really important to consider that. Joint mobility, improving that joint mobility, making sure that, our joints, we put a lot of stress on those joints, our knees, our hips. And so making sure that we're keeping those mobile and greased, I like to say greased as we age so they don't become weak. Um, can also help reduce signs and symptoms of other chronic conditions. And some of those chronic conditions include arthritis, diabetes, obviously osteoporosis, obesity, back pain. So really not just looking at the benefits for osteoporosis, but other chronic conditions as well. And then realizing that both types of diabetes are prone to developing a fracture. They're at a higher risk for developing a fracture when they consider to those who are not diagnosed with diabetes. So again, just realizing that even if you may have been diagnosed with diabetes, that may put you at a little bit of a higher risk for developing a fracture over time. But again, if you're able to stay consistent with exercising, it could potentially stave or hold off the possibility of developing osteoporosis. All right, so we're going to move on a little bit about some of the specific types of exercise for bone building or making our bones stronger, now that we know some of the benefits of physical activity. So when we talk about physical activity and really focus more on osteoporosis prevention or even maintaining that osteoporosis, we want to focus on those weight-bearing activities and really trying to incorporate strength and resistance training sessions into those bouts of exercise as well. So even doing a little bit can really help delay the onset of that sarcopenia or that age-related muscle wasting. Unfortunately, as we age, we do have the tendency to lose some of the muscle that we may have when we were younger. And so again, doing those weight-bearing exercises and strength training exercises really can help with delaying the onset of those conditions. So when we talk about weight-bearing exercises, for some of us that might be a new term, and we just think that physical activity and exercise is all created equal. So when we talk specifically about weight-bearing exercises, we want to focus on those exercises that are working against gravity. And so when we think about how that can help our bones, it's pretty much right there in the name. Just like the name says, we're weight bearing. So we're bearing the weight of our body and really working against gravity. So that weight bearing activity can help cause new bone tissue to form. It stimulates that growth of new bone tissue, and that can also make your bones stronger, and increase your strength as well, because we're obviously adding more of those bone tissue to the bones and the muscles that are already developed. And so during these weight-bearing exercises, the muscles kind of play a tug and war. They do a push and tug on the bone during the physical activity that's being performed. And that is what really causes the strengthening of the bone density and that bone mass. And so again, research continuously shows that these weight-bearing activities and exercises can really help slow bone loss for older adults. So again, focusing more on those weight-bearing exercises, you still might be asking yourself, well, why is it so important that we really focus on these weight-bearing activities and exercises? How does it really help prevent and enhance our bones? So As you may know, and those of us who maybe aren't so well versed in anatomy or physiology, at the ends of muscles are tendons, and the tendons are what attaches to the bone. So whenever tension is placed on that muscle, that force is also felt by the bone that's carrying that load. And so those weight-bearing exercises are really going to be good and puts tension on those muscles. You'll usually see this more or feel this more maybe around the hips or the spine, because certainly there's a lot of tendons that are attaching into ends of bones in those areas and those joints. And so over time, as the bones get used to that tug and push mechanism, they're going to respond by becoming denser and stronger in order to facilitate that movement a little bit easier for your body. All right, so we have a little bit of a game for you guys, and feel free to put in the chat. The chat monitors will help me out. Do we think walking, when we think about weight bearing or non-weight bearing, do we think walking is a weight bearing exercise or non-weight bearing? I'll give everyone a couple of seconds because I know there's usually a bit of a delay to put in the chat. Do we think it's weight bearing or not?
We
You
had
want,
one, some are saying it is and some are saying not.
okay. All right, well, that's good to know that there might be a little bit of confusion. So we can hopefully clear that up for everybody here. So yes, walking is a great weight-bearing exercise and especially a low impact weight-bearing exercise for cardiovascular health, but also for improving that bone density for everybody. So when we talk about walking, we can consider different speeds of walking. Fast walking, whether you're on a treadmill or outside walking around, that can be considered low impact weight bearing exercise. And that's going to be great because it's going to be, for the most of us, probably a fairly safe exercise that's going to be great for mimicking our activities of daily living because we have to move, we have to move around. We have to be able to have that ability to move independently as we age and try to retain that ability as much as possible. So while walking alone has been shown not to be an effective exercise for building bone mass, but it can help slow down that progression of bone loss. So again, if you are someone who has been diagnosed with osteoporosis and you've been okayed or cleared by your doctor, walking could be a great form of exercise to maintain that bone mass. But if you're looking to build your bone mass, it may not necessarily have great or significant contributions to building and improving that bone mass. But still, really a great overall exercise to be sure that we're incorporating into our everyday activities. I know a lot of times on the news, and there's some research coming out that's saying that, you know, those of you who may be familiar with like this, the activity trackers, they might have you try to set a step goal for every day. I think kind of the blanket recommendation that is out there is 10,000 steps every day. But I know that there's been some research that has come out saying that even if you don't get 10,000 steps every day, you're still going to see significant physical, at least balance or stabilization. Maybe not necessarily improvement, but that's going to at least maintain that health level that you're at right now. So again, 10,000 steps may be a little bit insurmountable or a little bit intimidating of a challenge or a number for some people, but just know that any steps that you can incorporate into your day are going to be more beneficial than not trying to build those steps into your routine. All right, so good job, everybody. Like I said, that's kind of a tricky one, so we've got a few more that we'll address here. Swimming. Do we think that swimming is a weight-bearing or non-weight-bearing exercise? And again, for some people, this could be tricky, so feel free to put in the chat whether you think it's weight-bearing or non-weight-bearing.
So far, we have a non-weight bearing.
Okay,
Non-weight bearing.
all
And
right.
it says swimming will strengthen bones. We do have one that says weight bearing, one that says not sure. and
Okay.
another non.
Okay. All right. So kind of all over the board a little bit. For most of the people, it sounds like most of them think that's non-weight bearing, and they're correct. So swimming is a non-weight bearing exercise. As someone had mentioned in the chat, it still is great for a lot of different reasons other than being specifically building that muscle or building that bone density. Because a lot of times people who may have injury injured something or maybe have gone through surgery, whether it be a knee, a hip, they might be told to avoid weight-bearing exercises for immediately after their surgery. You're still going to want to get up and walk and do some movement, but certainly not as much as you maybe were doing before you had that surgery. And so swimming is a great example of an exercise that you can do to keep those joints, keep that body mobilized and still feeling strong without necessarily putting a lot of stress and tension on joints and in your body. So swimming is still a great form of physical activity. But again, if we're looking at weight bearing versus non-weight bearing, it does fall under the category of being a non-weight bearing exercise. And again, thank you for your honesty for the people who said, I don't know. That's okay too to not know. That's why you're here to learn. All right, biking. How about biking? Do we think that's weight bearing or non-weight bearing? Again, feel free to put in the chat.
So I have a weight bearing, and then I have a yes, and I have a non-weight bearing. Mostly non, weight on legs, weight bearing. So kind of all over the place again.
All right, thanks, Marie. Yeah, so kind of all over the place, but at the end of the day, generally speaking, you classify or we classify biking as being a non-weight bearing activity. Again, most of your body is supported by the seat of the bike or your hands on the handlebars there. So you're taking some of that weight, your own body weight, off. And you're still biking against resistance, sure, and whether or not you're going up hills, you might be add more resistance, but for the most part, your body is supported in a position, so you're not having to bear that weight specifically against gravity. So in that situation, biking is considered a non-weight bearing physical activity. All right, you guys are doing good. There's a couple that are all over the board, but that's okay. Like I said, that's why we're here to learn. Now, what about yoga? For those yogis out there, yoga is a great form of physical activity. Do we think it's weight bearing or non-weight bearing?
Okay, I have so far 3 weight, 1 non. I love me some yoga. I really do. I have another weight bearing. So we're kind of more on the weight bearing side than non.
Okay. Yeah, and like Marie too, I love my yoga. I can tell a huge difference when I'm not practicing yoga consistently in my body. I just feel a little bit tighter, a little bit more tense. So it is a really great form of physical activity that can be modified for all abilities. They have chair yoga classes, so you don't even have to get on the floor. It really is a great practice. But yes, so back to weight bearing versus non-weight bearing. It's kind of a trick question. So we threw a curveball at you guys today, or with our yoga question. So it really does depend if you are using your body weight to execute the pose. Um, and there's different forms of yoga as well. There's some that are strength yoga or power yoga, where you're holding a pose for a longer amount of time. And that might be more weight bearing as compared to more of like a flow yoga, where you're just flowing through the different poses. But this image specifically, and I can't quite recall the name of it, so don't ask me offhand, but the one that's on your screen in front of us would be considered a weight-bearing pose because, again, you're holding that pose and you're fighting your muscles, your body are working against gravity to bear the weight while you maintain and hold that pose. So again, there's exceptions. It's still physical activity. And again, yoga is still a really great practice, whether it's weight bearing or non-weight bearing. So don't shy away from using it or practicing it, just because it may not be quite as weight bearing as walking. So, and the same holds true if we think of Pilates. Some people put Pilates in the same category as yoga, even though they're two different forms of exercise. But again, with Pilates, it can be considered weight bearing, especially when we're standing for those exercises. Right. So good job, everybody. And like I said, that last one with the yoga, we threw a bit of a curveball at you. So moving on to strength and resistance training. So another good way to make bones feel that tension and to make them really work is to perform resistance training. Resistance training can be your own body weight or using inexpensive equipment like resistance bands or dumbbells. I know many of those things are now available at dollar stores. So if you just go to your local dollar store, you might be able to find even pretty inexpensive exercise equipment that you can use too. But there's always the option to use equipment at a gym, really having your muscles and having your body working against any external force. So instead of just gravity, you're adding a little bit more resistance into those muscles to make them work a little bit more. So there's examples that are listed on your screen include that training with dumbbells or hand weights, barbells, machines, resistance bands, or again, even your body weight can be considered resistance training. So resistance training are exercises that can cause the muscle to contract against an external resistance, such as a dumbbell or tubing like you see on the screen there with those individuals. And again, increasing that resistance and that external force against gravity. So it's taking it up a notch from that weight bearing and non-weight bearing by adding in another external object, whether it's a resistance band, a dumbbell, or like a barbell, or any other sort of mechanism. So weight bearing actually is included in resistance training just because you are working against that body weight. But the most common examples you'll see might have some sort of, like I said, whether it's a loop, a resistance band, a dumbbell, or a hand weight or something else. And so a great example of a piece of exercise equipment that's travel friendly are these mini bands or these resistance loops that you see in that picture, or the resistance bands that might be a little bit longer with handles. Dumbbells are a little bit clunkier to travel with, but it is doable. It is possible. All right, so specifically for strength and resistance training, the recommendation is to do that 2 to 3 times a week on non-consecutive days. So then you could do a Monday, Wednesday, Friday if you want to do 3 days in a week, or a Monday, Wednesday, or a Wednesday, Friday, for example, just making sure you're taking a break in between those days to allow your muscles to fully recover and to rest before that next workout. So we also want you to keep in mind that in order for the resistance training to work, we want you to challenge yourself a little bit. You want the weight to be heavy enough to make your muscles feel that extra force or that extra push. Want to make sure that you are exercising safely. So we're not asking you or telling you that you should go and buy a 25-pound set of dumbbells and start doing bicep curls with those, but make sure that you're able to exercise and lift the weight safely in a controlled manner and for a nice slow count of like 1, 2, 3, and then releasing for 1, 2, 3. So again, we don't want you starting off at the heaviest weight. Really recommend that you choose a weight that allows for you to do 10 to 15 repetitions. So I know that on the screen, 10 to 15 is for that 65 plus age group. If you are under 65 and joining us, you can aim for that 8 to 12 and try to maybe increase that weight a little bit more depending on your training level. But you just want to be sure that you're challenging yourself without going too hard, especially if you're new to resistance training. So again, there are some very specialized trainers and professionals out there that if you're walking away with this and feeling a little confused, if you go to your local fitness center, you should be able to talk with someone who will hopefully give you a little bit more specialized or specific recommendations based on what your capabilities are and what you feel comfortable with. Another great resource could be a physical therapist or even a physiologist if you have that available in your area that can help you provide those more individualized recommendations. The big thing that we really want to emphasize is that we want to make sure that you are checking again, going back to your doctor or your provider, make sure that they believe that's safe for you if you haven't already to begin resistance training, and they might be able to help guide you to someone who can be more specific and really help you with your exercise programming. All right, so when we talk about those physical activity guidelines, it changes as we age and move throughout our lifespan. So when we're adolescents, bone strengthening is really important, really crucial for this age group. It's when that bone mass really starts to gain and we start to increase our bone mass. Um, and so when we think about bone strengthening exercises, we're referring again back to those weight-bearing exercises. So again, walking, maybe running or jogging if you feel comfortable doing that, could be great examples of those weight-bearing exercises that are also bone strengthening exercises. And that overall guideline is that 60 minutes of moderate to physical or to vigorous intensity. And so one way that I like to kind of coach people is how can you tell if you're exercising moderately versus vigorously? One simple way or one really easy way to do that is the talk test. So if you're by yourself or walking with someone else, you want to be able to carry on a somewhat normal conversation with that person. Or if you're walking by yourself, maybe you're talking to yourself out loud. Let people maybe question you a little bit, but it might look kind of funny. But if you're able to have a fairly normal conversation without a lot of huffing and puffing, then that means you're probably working out at a moderate level. Now, if you were able to sing the lyrics from your favorite song, that would be more of that light intensity. So that's a good sign to maybe bump up that pace a little bit, or maybe try to incorporate more hills into your walk to get to that moderate level. And if you're working vigorously, you're going to probably be huffing and puffing a little bit more. So you might only be able to get 1 or 2 words out at a time, but not able to really complete those full sentences. So again, looking at those bone strengthening activities, their recommendation is 3 days a week. Those muscle strengthening activities, we really want to be sure that we're including and incorporate all the different muscle groups, which can include the legs, the hips, your chest, your back, your abdomen, your shoulders, and your arms. There's no specific time that's set for this muscle strengthening session recommendation, but it should be done until you're unable to complete another rep. So again, going back to that 3 times per week, 2 to 3 times per week, maybe 8 to 12 reps or 10 to 15 if your age is 65 or older, and then maybe doing that for maybe 2 to 3 sets. And so that can really help improving strength. And then, of course, your aerobic, that's going to be more of your cardiovascular health physical activity. So again, anything that really is elevating that heart rate is going to be considered aerobic activity.
So Amber, while
Yep.
we've had lots of things going on in the chat, and one of them was about doing upper body one day and lower body the next. A lot of people need that discipline of of going to the gym because it's an accountability thing. So it's great to do that. If you just make sure you're disciplined enough that you're not going to overwork yourself. That's the whole goal. So if you can stick to an upper body routine one day and a lower body the next, then go for it. Really good information there.
Yeah, perfect. Thank you for Marie. And feel free to interrupt if something is relevant and is coming up in the chat. So thank you for that. Um, so yeah, and that's going to look a little different for everybody. So again, whatever level you're at, we probably have all abilities on the call with us today and listening to the recording. So certainly whatever level you're comfortable at is always a good place to start or even continue if you've been doing something that works for you. So when we look at more of the adults and their physical activity, again, the slide before focused on more adolescents. For adults, you're still looking at those muscle strengthening activities 2 or more days per week. And again, including all those major muscle groups we just talked about. Um, Still, looking for that 10 to 15 or 8 to 12 repetitions if you're bumping up that resistance or that weight a little bit more. And then that aerobic level is 150 to 300 minutes of moderate intensity, which again, if you use that talk test, that's a great indicator, or 75 to 150 minutes of vigorous intensity per week. So again, moderate intensity if you're talking, or if talking to yourself, I always like to say if you're being kind of goofy, or if you're exercising with somebody or walking with somebody, just checking in and having that conversation. Vigorous might be more of a jog or a run where you're huffing and puffing and can only get a few words out at a time. All right. So when we look at older adults and those physical activity guidelines, really want to, again, look at those different categories. So those muscle strengthening, you're going to see that's pretty consistent throughout all age groups, adolescents, adults, and older adults, 2 days or more per week. So 2 to 3 non-consecutive days, and including all those major muscle groups. The aerobic recommendations are still 150 to 300 minutes of moderate activity or 75 to 150 minutes of vigorous physical activity. And then we also want to think about incorporating some of that balance training. So whether that be maybe a yoga class or even just some of the exercises we talked about and you got in your handouts from last week, just incorporating those balance exercises into your everyday routine, whether it's brushing your teeth if you're standing on one foot. That was the example of what I do typically, just to kind of throw that into my everyday routine. But also trying to get that in about 3 days per week too, to try to maintain our balance as we age. All right. So again, when we think about some of those exercises specifically, we can think about those body weight exercises, walking, jogging, hiking, dancing. Certainly not an exhaustive list, but it gives you a pretty good idea of some of those body weight activities that you can think of. Free weights, like dumbbells, those wide leg squats with a bicep curl. So combining a couple of exercises together for more of a complex movement. And one thing that you can do when you have those free weights is that you can really look to increase that weight over time. So you really want to try to keep it at that 8 out of 10 difficulty level. So if you feel after a while your body is tolerating that 5-pound dumbbell, it might be just bumping it up a little bit to 7.5 pounds, but maybe not doing quite so many repetitions. So again, free weights, that's another example of a dumbbell exercise. And then resistance bands, a great exercise for that would be the chest press that you can use with a longer resistance band. So again, really thinking about those weight-bearing exercises that you can fit into your everyday lifestyle, such as climbing stairs, or taking an extra lap, maybe around the office if you're working, around your desk, or even if you are working from home, or maybe just going out and checking the garden or the plants around your house. Those are going to be great weight-bearing exercises that you can fit into your day too. All right. So now I think I will stop my share because we just wanted to demo a couple of simple exercises that you can incorporate into your everyday activity or everyday routine. And let's see, might have to. And then, yep, like Wendy had said, I do see that now. We'll be able to share resources on different exercises. And so let me see, I might have to take off my background. So we're going to start with simple exercise. It's a shoulder retraction. So again, you can just be sitting nice and tall in your chair. For this one, I don't think I necessarily have to take off my background. And so for those shoulder retractions, we're really working on our posture too. So it gives us a chance to sit up nice and straight. And then we're just going to be pulling those shoulders back and releasing. So you can think about sticking your chest out a little bit, but really pinching those shoulder blades nice and close together. I like to use the cue like you're squeezing a pencil between those shoulder blades. Again, you want to make sure that your feet are flat in the floor. Arms can just be hanging by your side or resting on your thighs, and just pulling and holding and release. So if you add a nice little slow count, we can go 1, 2, 3, and 1, 2, 3. So again, with those shoulder retractions, you don't need any weight for this exercise, but you can certainly look to maybe increase those repetitions to that 10 to 15 range as long as it feels good for you. Sometimes you might catch yourself slouching forward. So I like to always say, you know, do a nice big shoulder roll to make sure you're just sitting up nice and straight. And this is a great one if you are someone who has maybe been sitting quite a bit or just stuck in Zoom meetings all day and just need to stretch out those muscles a little bit. This is a great one. So those are the shoulder retractions. And then I am in my conference room, my office conference room, and I'm also going to say that I'm tall. So I'll have to adjust my computer a little bit or my screen so I can show you the heel raises as well. So I'll turn this off. Now I'll have to take off my headphones. And hopefully you guys are still able to hear me. Wendy, Marie, can you guys hear me okay?
We can.
Perfect. All right. So I'll move my chair out of the way. So you can have a chair there for balance with this exercise. This is the heel raise exercise. And like I said, I am tall, so I might have to scoot back a little bit or bring my camera down so you're able to look at my feet. So you might hear this as a heel raise or even a calf raise exercise or toe stand. Good for balance as well. You can stand with your feet about hip width apart. If you have them a little narrower, that's going to be more challenging for your balance. Or heel to toe, which I believe is also in your exercise resources and handouts. That's going to be a great one to challenge your balance. But the basic heel stand is going to be feet on railroad tracks. Toes pointed straight ahead, nice wide base underneath you. Got a chair there for balance that doesn't have wheels. You're going to come up, 2, 3, and down, 2, 3. Up, 2, 3, and down, 2, 3. Up, 2, 3, and down, 2, 3, and up, 2, 3, and down, 2, 3. And so like I said, you can certainly challenge that balance by bringing those feet in a little bit narrower, doing heel to toe, and coming up. Still toes are pointed forward and down, and up, and down. But be sure what you're doing on one side, you do on the other side. So you want to switch those feet and work on that balance on both sides. Be sure you're breathing. It's always good to count out loud to ensure that that breath is going in and out. And again, if you want to challenge that balance a little bit more, you can float those hands above the chair. I'd still have it there, but you can maybe float and down. 1 and down. So a couple different ways to challenge your balance there with those exercises.
And
Oh.
that was great, Amber. I wanted to point out though, one thing that you could see in your demonstration really well was that when you were doing your heel stand, you're going straight up and down as opposed to falling forward toward the chair. So just keep that in mind as you practice at home.
Yeah, so if anybody has any questions about those activities, feel free to put those into the Q&A or the chat. And I believe, let me see if I can reshare my screen again. And hopefully you had a chance to kind of practice those too a little bit. Oh, Wendy, you got your screen up? All right. So let's see if I can hide that. Open this back up to the nice version for you all. So again, if you do have any questions about those activities, feel free to ask questions.
There are more exercises available in the handouts that you are given as well. All right, so if you have low bone density, brittle bones, or osteoporosis, you might be questioning, should you exercise? You might be scared to do exercises, which is understandable. You know, we fear the unknown, so not knowing our limitations or having a clear idea of what those limitations might be, we don't want to cause more damage. So we do encourage you to exercise, recommend you to exercise to maintain that bone mass and reduce that osteoporosis risk. So really focusing on those two main pillars of that exercise program with weight-bearing exercise and endurance activities and also resistance training. And again, we always like to add, be sure that you're checking and consulting with your healthcare provider before you begin any sort of exercise program. And with that, I think I'm going to turn it over to Wendy.
Absolutely. Thank you for the demonstration. And I know a couple folks have mentioned giving you a thank you in the chat. And one suggestion was for including 1 pound wrist weights to help strengthen wrists and arms, but also that's adding to your weight bearing exercise too. So great. That's really good to hear. So one thing we do know that with osteoporosis is that yes, we want you to exercise, but you want to exercise in a little different way, but we want you to do it safely. And there are some exercises that for the general population that you may not want to consider simply because the risk simply outweighs the benefit of the exercises. And here you see there's a positive correlation between bone density and exercise. However, if you do have osteoporosis or even low bone density, you want to choose those low impact weight bearing activities. You see the two ladies here in the image here doing a nice little fast paced walk, which would be a positive low impact weight bearing alternative. So the two boxes that you see, the blue and the green box, the low and the high impact exercises, these are all weight bearing exercises. They're all bone builders. And if you have the low bone density, or if you even have diagnosed osteoporosis, then we want you to first, of course, speak to your healthcare provider. That way you can get a personalized exercise routine or recommendations. And often these plans that they're going to recommend is going to include some of the things that Amber was talking about, such as posture and balance, as well as gait and coordination. So those will all be a part, but some of those low impact activities, like you can see here on the slide, there's also treadmill walking, again, low impact aerobics, the fast walking, like you saw the ladies on the previous slide, using an elliptical machine. So we haven't mentioned about an actual machine for this type of exercising, but also even stair step machines. Now that's going to be on a low impact, in a slower pace. So again, choosing those low impact exercises. So if you do have low bone mass or osteoporosis, we want you to reference the left side of the left column on the slide. So there's a few exercises that you see listed. We just did a posture exercise, but we want to do posture in conjunction with strength training. And what that's going to do is going to reduce your risk of a bone break. Then with exercises for back and spine, that's going to help prevent that forward or rounded shoulders that you might see with individuals, the dowager's hump that we talked about earlier on. There are also posture exercises that you're going to find in our previous week handouts. So the one that we had, that I believe it was from the Bone Health and Osteoporosis Foundation, there's a few posture exercises in that one that you could easily add to your weekly routine. There's also some other exercises listed on those handouts for balance. I believe the toe-to-toe walk was even in there. But again, if you're doing the toe-to-toe walk, use a wall. That way you have an easy support system there. And I know Amber mentioned earlier about activities of daily living. So I don't know where I read this just recently, but someone said, I believe it was a journal article, and it said, you got to be able to bend down and get those Amazon packages. So 'tis the season. But again, you want to be sure to incorporate those functional exercises because you want to be able to get down on the floor with your grandkids. You want to be able to reach up for milk out of the refrigerator easily or reach that higher shelf. And just doing those basics for every day. But some of the exercises that you want to avoid, and you can see those flexion and twisting. So that if you've got that low bone mass or diagnosed osteoporosis, anything with spinal flexion or like turning, and then also the bending forward at the waist with straight legs. So think about like if you're to put, that's where that spinal flexion comes in. Think about if you put, I'm thinking of my mom putting her cat food down on the floor. And what does she do? Exactly that. So she's bending really at her waist with straight legs, a little bit of rounding there, but again, not twisting or rotating. So it's just something that takes practice. Amber mentioned earlier about seated exercise. She talked about chair yoga, which is really great for anyone that if you have any type of balance concerns, it's a great way for you to continue to be physically active. It's a great idea to use a chair, not with wheels, but a nice stable chair. You can also use the wall, like I mentioned, a kitchen counter. Here I have a desk in front of me that might be good, especially if it's a standing desk. It's got a little extra levels there. What the goal is to obviously reduce your risk for falls, but there's other options that you can try. Exercises with some modifications, and that means adding some stability. Like I mentioned, the chair. You can do, most of us are pretty familiar with what a squat looks like. So a modification is simply standing up and then act almost like you're going to sit down, but hold that motion almost like you're going to sit, but just hold. Now, if you feel pressure in your knees, go ahead and bring your body up a little. Don't go quite so far down and just hold. Instead of having that up and down motion, you're just going to hover. Another option is to standing hip extension, which is one of our resources that we'll be sharing with you. And I believe it was in the handout as well, where they're doing a standing hip extension or the standing heel raises, as Amber just demonstrated. All you're going to do is simply add in a chair for those. That just provides you a little bit of more support. And I like Amber's idea. You can kind of hover. You can even use 2 fingers on the chair if you need to, while you're building up your balance. I know we mentioned a few of these, although they are definitely worth repeating. So some exercises to avoid when you have osteoporosis, including that spinal flexion, twisting, and excessive arching. So that excessive arching, think about the pet food going down on the floor, or maybe you're picking up your newspaper. So keep that in mind. Spinal loading. So basically that's any weight that you have above that weight is pressing down on your body. So I saw something about quickly in the chat, I saw like a weighted vest. So if you have osteoporosis, that would be something you wanted to check with your healthcare provider on that. It depends on there's a lot of different types of vests. So you want to look and see how much weight is in that and if that's too much of a load. Amber, do you want to add something on that?
Well, there was also something in there, Wendy, about rowing machines as well.
Mm-hmm.
And I'm going to say that's going to be very specific to a person. So I would suggest they would speak with their physician, especially if they had been diagnosed with osteoporosis, because depending on the site, maybe if it's a spinal thing, they might not think rowing would be a good idea, but it's very individualized.
Yeah, no,
So-
nothing really, no, sorry, I was just gonna say, Wendy, nothing really to add to that. You did a really great job of explaining.
Thank you. And so again, even if you think about rowing, if you're bending forward, form is really going to be important. And we're going to talk about that here coming up. So when we think about high risks activities or high risk for falling activities, what might be some examples? And you can type in the chat. What might be some things that would be considered a high risk?
Sometimes, depending on who you're playing with, it could be pickleball.
Yeah, some hardcore fans or hardcore sports enthusiasts.
Yes. So, climbing on a chair.
Mm-hmm. Climbing up in a chair.
Oh,
Yep. Motocross.
motocross. Yes. Okay.
Most definitely. And you can see, high impact
Zumba.
Zumba. You know, and
All those
actually,
pictured.
yep, I had a colleague just recently taking a Zumba class and really tweaked her back. So again, coming back to form, most definitely. Anything to do with snow sports, I think there's always a risk. Walking, if you have ice on the roads, if you're here in Florida, perhaps it's a pothole. I'm not sure. But again, skiing, skating, walking, if the ground is uneven, climbing up ladders, horseback riding, gymnastics. We just saw the Olympics. Most of us are probably not doing that type of tumbling, but and any type of contact sports. And I'm glad you put that, Sarah. I'm glad you put that in the chat for changing a light bulb. You're absolutely right. So again, those are high risk for falling, especially if it includes getting on a ladder. So other components for strength training and just exercise in general, we talked a little bit about the posture activities. So again, it's that proud, I don't know why I say proud chicken, but I do, but it's kind of sticking out your chest. Again, a nice and proud posture. One thing to keep in mind is don't let those shoulders rise, especially if you're working on a computer, if you're just surfing the internet. Oftentimes you'll start to feel you tense here. And we don't want to wear them as earrings. So make sure they're nice and loose, like Amber mentioned about doing the nice roll, just to go ahead and get those back down to be able to bring your chest up. Gait is another area that we want to work on and pay attention to. So what we want to do is making sure that we are picking up each foot in order to keep ourselves from shuffling our feet, because it typically, with shuffling, it can definitely increase your risk for falls. And then for balance, we want to definitely practice those daily, do them consistently. Maybe it's okay, you've got to pair it with another activity you always do. Amber mentioned about brushing her teeth and balancing. So maybe that's your time to do one or two exercises on a daily basis. So this is an excellent resource, and I will try to get this into the chat before we close today. It's the National Institute on Aging. They have an amazing website that has, and it doesn't matter your age for these types of activities, but it goes through safety tips and a multitude of activities. And it also making sure that you are following the proper form. But again, a great resource.
Wendy, there was a question about doing a shoulder press
Mm-hmm.
and it being a extra load on the spinal column.
Mm-hmm.
Should that be avoided or not? Again,
it would be a load. I mean, to me, it would be because you're pushing up. That would push a load on it. But again, it depends on form, I would think, and also your current
ability.
status. Yeah.
Yes. So that's a very subjective question. If you have a injury or a question about it, or if it's something you're interested in doing, just make sure your physician feels it's safe for you to perform. My mom, that would not be an option for her with her osteoporosis load. But others, you know, it might be a good way for them to actually
Mm.
strengthen more. Um, then it says on stairs, use handrails. Oh, absolutely, 100%. Yes. That's why they're there. Please use your handrails.
Mhm. All right. And so on this slide here, the National Institute of Aging, also on aging, they also have a YouTube channel for Go for Life exercise videos. Now, again, not all of these are going to be specific for osteoporosis. This is just for general population, so please keep that in mind. But there's a lot of chair exercises, balance that you could practice. I believe they still have a downloadable book that you can even for a digital download to get that goes through different activities that you and many have modifications. We always encourage you to reach out to your local extension office to see what types of exercise programs that they have. Sometimes we have some strength training programs that would be appropriate. Check your community centers, anything that in your local area. Now here's your checklist for at-home fitness equipment. And first, you need that sturdy chair without wheels, and even one that doesn't slide. Sometimes they have metal legs, and those tend to slide. So again, making sure it's nice and sturdy. You want to have ample space around you, and of course, choose a rubber-soled shoes. And keep in mind that a lot of them, some of our newer sneakers are going to have a thicker sole, but be cautious with those because those sometimes can increase your risk for falls. Handheld weights, easy. Amber mentioned them being inexpensive. You may have to purchase more as you build your strength, but I think that's a doable option. I know folks have mentioned using cans of soup or even water bottles. Sometimes if you don't have the mobility in your hands, you can even put them in a sock to do that. They also have the dumbbells that have the Velcroed handle that can help you with that as well. Ankle weights are another option, and they have weighted tubes typically in each of the little columns within the ankle weight, so you can make adjustments for that too. So that's another option. And I know we're getting close to time, so let's go ahead. I'm going to not zip through, but again, physical activity tips here. We want you to always encourage you to either, of course, your healthcare provider, but work with a certified personal trainer or a physical therapist to learn the appropriate form. Don't rely on online resources all of the time. It's really good for you to have that self-check so you're not injuring yourself further. Warming up and cooling down. They not only help with your heart rate, for bringing that up gradually and bringing it back down to resting state. But we want you to also think about challenging your muscles because we want you to do that a little bit, but in an appropriate time frame for you. Hydrate. Hopefully no one is forgetting to hydrate these days. It's been so warm. And then we want you to start at your beginning level. Everyone's got a baseline. But again, you want to compare against yourself. So in just today's session, we've talked about why bones are important, what your risk is, focusing on lifestyle, specifically physical activity benefits and types of bone building exercises. We've provided you with a variety of different bone building exercises, weight bearing and strength training or resistance training. Amber shared about the current physical activity guidelines, how to approach physical activity if you do have low bone density or osteoporosis, looked at posture, alignment, your strength and balance, and ideas for your home fitness. So you don't always have to be in a gym, but we do want you to be safe. And then a few physical activity tips. And then a few resources to help guide you to healthier, stronger bones. And this is one of my favorites. The best exercise not only is something you enjoy, but one that you will do. So we hope that you will find one and get started. And as you're thinking about your bone building steps, your goal setting for today. Um, I'm going to go ahead and pass it back to Amber to kind of do a recap on all of our sessions.
Yeah, thank you, Wendy. So feel free to put your steps, your goals for this week with physical activity into the chat to share it out. We're going to do a quick summary of the 7 weeks that we've been together. So we've reached that top stair in our bone building steps. And so we're going to take just a few minutes to look back at what we learned. So there are a number of things that you can do to reduce your risk for osteoporosis. So by knowing those risk factors, really focusing on which ones you maybe can't control, those uncontrollable ones, but knowing what your risk is, but then really honing in on those ones that you can control. We talked about your lifestyle changes, increasing that calcium and vitamin D intake, increasing that physical activity and really incorporating it into your daily routine. Nicotine use, if you are someone that's using, how you can look at reducing that. And then, of course, moderating those consumptions of alcohol and really trying to limit that intake of that. And then also medications as well. Talked quite a bit about different medications and how to be knowledgeable about what those all do. So screening for medications and then also supplements. So again, feeling empowered to have those discussions with your healthcare provider, the medications that can affect your bone health for better or worse. If you have questions on them, any supplements you're taking, and feeling strong and empowered to ask your doctor if you have questions about those supplements. Any sort of drug and supplement interactions that can occur if you're taking multiple supplements. And then how often, or if you feel it's necessary for you to have a bone mineral density tested. We talked about all those things. And then moving into nutrition, really focusing on proper nutrition as the foundation of good health. So good nutrition is going to help you maintain a decreased chance of developing chronic diseases. So focusing on those nutrient-rich foods, including a variety of foods. We always talk about eating the rainbow when it comes to your fruits and vegetables that you're eating. Again, cannot emphasize calcium and vitamin D, really looking for more ways to incorporate that into your diet. Making smart decisions when you're choosing those low-fat options over, more higher, fattier foods. And then being knowledgeable and reading those nutrition labels, not just paying attention or, paying attention to the claims they make, but really actually turning it around and looking at the label. And then staying strong for that last step. Doing those balance exercises, the weight bearing exercises we just talked about, and then also incorporating resistance exercises into your week. Again, focusing on starting gradually and building over time. We don't want you and don't feel it's necessary for you to go out and lift excessive amounts of weight or have this big goal that might be unrealistic, but really focusing on those SMART goals that make it attainable and timely. Be sure that you're always checking in with that healthcare provider. If you're making any sort of major changes to your physical activity, medications, nutrition, really any of the areas we covered, always want to check in with your healthcare provider to get their approval, get their go-ahead, and really use them as a resource too, to help you on your journey. And like we mentioned, your homework last week was to check your house for hazards to reduce your risk of falls. I'm hoping some people put that in the chat. I haven't had a chance to look, but again, just being vigilant and being aware of what might be fall risk inside your home and possibly adding some of those safety features. And I know we're coming probably past 3 o'clock, so thank you for everyone who has stuck with us. But we just want to share again our team. You've been introduced to all of us throughout our 7 weeks together. And it has been wonderful to get to teach you and teach alongside these individuals the past 7 weeks. So hopefully you find this helpful information and we were able to give you some great resources to keep with you.
Yep. And Amber, I want to say thank you to all the participants that have joined us. Thank you to our multi-state team. We couldn't have done this without you. And I feel like it's been a great success. And then finally, I want to thank Dr. Wendy Dahl our professor in human nutrition and dietetics, also our nutrition extension specialist at the University of Florida in the human nutrition department, so, food science and human nutrition. But I just wanted to say, without her, we could not make this possible. And again, thank you all so very much. And I believe we're going to open it up for some questions.